Well, the summer bug season is in full swing here. We're talking about pesky mosquitoes, flies, and insects here, and they can cause annoying bites as well as carry some serious diseases. UConn Health Center sent over infectious disease specialist Dr. Dieckhaus, and you're here to talk about the safety precautions that we can take to make sure everything is okay.
Yes, thank you. Good morning.
Thanks for joining me.
Thank you.
So let's talk a little bit about the bug season. How bad is this season supposed to be?
Well, given the wet weather that we had earlier in the year, it's predicted to be pretty bad, so especially with mosquitoes this year.
So when you're talking about mosquitoes, everybody usually says, get some kind of repellent that contains DEET. Do you agree? Right.
There's actually over 400 different varieties of insect repellents out on the market. Most of them have some variety of DEET in it, though. There are some others. What the consumer should be looking for is the DEET concentration of over 20%, and be very careful about reading the manufacturer's label in terms of how long that lasts. Different concentrations last for different lengths of time.
How safe is this for kids, though, for toddlers, babies? I'm wondering how safe that can be.
Right, it's a very good question. It's been studied and is extraordinarily safe in children as long as adults use it sparingly on the kids. What you want to do is you want to apply it sparingly on exposed skin. When the kid is back inside, you want to wash it off. And really the toxicities that have been reported have been parents who have been overexuberant in applying it to their kids.
Okay, and when we're talking about ticks, infected ticks usually don't spread Lyme disease until they've been attached for quite a period of time. So how much time are we talking about, and what are things that you can do after a hike, perhaps a stroll through the reservoir? You come back, you want to make sure that you don't have any ticks on you.
Right, well, so first of all, a tick would need to be embedded for 24 to 48 hours at least before it can transmit Lyme disease. While you're on the hike, wearing insect repellent with DEET or permethrin. When you come back, you want to make sure that you do what's called a tick check, which is to look at all of your skin surface area and remove any ticks that you see.
Even with your hair, I mean, what are you looking for? Just a little, how do you know that it's not, you're looking for a certain bump, or what are you?
Basically you run your fingers through your hair, and these are really, really tiny critters. If you do find a tick, and if it's embedded, you want to get someone to get a tweezers and really just apply very firm pressure. Don't twist it, don't do any of the folklore remedies that your mom may have taught you. Just basically a firm pressure to try and remove that tick.
What are other common mistakes that people make when it comes to repellents, or when you're talking about mosquitoes, flies, ticks, because obviously they carry some pretty serious diseases here?
Right. Well, first of all, the incidence of disease. Connecticut is a Lyme endemic state. There's about 3,000 cases of Lyme disease, and it's very high, second highest in the U.S. But not to get overly concerned about it. You want to take appropriate precautions with DEET and permethrin. Related to mosquitoes, West Nile has gotten a lot of press lately, but actually there's only been 10 cases in the last year in Connecticut.
So the one that you would think to be a little bit more cautious of would probably be Lyme disease, as opposed to West Nile.
And tick-borne illness, right.
Okay, and anything else that you can do? Let's say you're at a picnic or something outside. Can you put, that sometimes they have those certain repellents, could you put that up as a second precaution?
Right.
Not only just taking care of yourself. But
right, so having an environmental precaution, so burning insect coils. There are some commercial applications of insecticide that you can use specifically for ticks that can reduce the incidence of ticks in your yard.
I mean, as far as this is obviously a very serious matter, but sometimes people don't take it as seriously.
Right. No, it's an important, these are important diseases that can cause real illness and are very easily prevented by just taking some very simple precautions.
That's the key. They're very easily prevented if we just pay attention and look out for those things.
That's correct.
Thank you so much, Dr. Dieckhaus. I appreciate it.
Great.
There we go. Thank you so
much.
I appreciate it.